Welcome to another deep dive. You know, getting ready for this one, I found this podcast intro, and it really got me thinking.
Right.
It talked about how more than 75% of American workers report having mental health challenges. And I thought, wow, that's a lot of people, you know. It made me wonder about the bigger picture.
Right, like how those struggles connect to a global perspective.
Exactly. So I grabbed some World Health Organization reports
Oh, wow.
to kind of get that global view.
What'd you find?
Well, the contrast is pretty amazing, actually.
In what way?
The WHO reports say the treatment gap for serious mental disorders in developing countries is it's massive, something like 76.3 to 85.4%.
Wow.
Yeah, that's a huge number of people who don't have access to the help they need.
It is, and the WHO points to some key factors.
Like what?
Insufficient funding, obviously a lack of trained professionals,
Right.
and a real concentration of resources in urban areas.
Which leaves rural communities.
High and dry.
Yeah,
Much.
yeah. It's almost like the healthcare system itself is part of the problem.
Yeah, I see what you mean.
And then there's prevention, which the WHO says is a tricky thing with mental health.
Oh, how so?
Well, it's not like other health issues, right? You can tell someone to quit smoking to prevent lung cancer.
Sure.
But mental health, there's no easy fix.
It's so much more complex.
Right. It's not just about individual choices.
It's this web of social and economic and even political factors.
The report specifically mentioned poverty, inequality, and even things like political instability.
Yeah, all these massive forces.
How do you prevent that?
Exactly. And that's where the WHO is pushing for a new way of thinking about prevention in mental health.
What do they suggest?
Well, they're saying we need to go beyond just focusing on traditional risk factors.
And include.
Early detection and treatment as well.
So it's about catching those warning signs.
Yeah. Stepping in before things become a crisis.
Like preventative maintenance for your mind.
I like that analogy.
And they also talk about integrating mental health services into primary health care.
Right. So your GP could be your first point of contact for mental health concerns.
That would be amazing, especially in places where there aren't many mental health specialists.
It would be a huge step forward for sure.
That makes me think about something else that podcast intro mentioned.
What's that?
The stigma around mental health.
Yeah, that's a massive issue.
It's like this invisible wall.
Keeping people from getting the help they need.
Exactly. And when you think about how many people are struggling, it makes you realize we need to break down that wall.
Absolutely.
But the WHO report, it actually highlighted an even more extreme example of stigma.
Oh, right. The Chain-Free Initiative.
Yeah, that one really stuck with me.
It aims to stop the practice of literally chaining people with mental health conditions.
It's horrifying to think that still happens.
It does, and it just shows how much work we have to do to change attitudes and beliefs.
It's a stark reminder of how cultural beliefs can have such a powerful and sometimes harmful impact.
It really puts things in perspective.
It does.
It shows that tackling mental health globally requires us to address these deep-seated issues.
It's a battle on multiple fronts, isn't it?
It is.
We need to improve access to treatment,
Of course.
but also challenge those ingrained beliefs.
And create a world where seeking help is seen as normal and encouraged.
It's a huge task.
It is, but it's essential.
Absolutely.
Yeah.
So we've talked about this global landscape
Right.
with the disparities in care and the stigma. And honestly, it feels a bit overwhelming.
I can see that.
But what about us as individuals?
What do you mean?
What can we do in our own lives to take care of our mental well-being?
That's a great question.
I've read so many articles with tips and strategies, but it's almost like too much information.
Like a buffet where you don't know where to start.
Exactly. So maybe we can break it down.
Okay.
What are the essential things everyone should know, regardless of where they live or their background?
Where do we even begin? Well, a good place to start is actually pretty simple. Taking care of your physical health.
Oh, really?
Yeah, all those lifestyle articles, they all talked about the basics.
Yeah.
Exercise, sleep, nutrition.
Okay.
It's like you're building a house.
Mm-hmm.
You need a solid foundation.
Right.
You can't have a strong roof if the base is shaky.
I get the analogy.
So those are the building blocks for good mental health.
I have to admit that when I'm stressed, those are usually the first things to go.
Yeah, I hear you.
Late night pizza Netflix binges.
It's easy to fall into those patterns.
Are we talking major lifestyle overhauls here? Or can small changes actually make a difference?
You don't have to go from 0 to 60 overnight.
Okay.
Even small, consistent changes can have a big impact on your mood and energy levels.
So maybe swapping that pizza for a salad once in a while isn't a bad idea.
Exactly. Every little bit helps.
But what about when those little tweaks aren't enough? Like when life throws you a curveball?
You're right. Self-care has its limits. Sometimes you really need professional help.
And thankfully that's becoming more accessible.
Definitely.
Even for people in remote areas, thanks to telehealth.
Right, and some platforms are even offering therapy sessions at a fraction of the cost of in-person therapy.
That's amazing. It makes therapy so much more accessible.
It really does. It breaks down a lot of barriers.
So it's not just about the cost.
Right.
It's also about convenience and even stigma.
People might feel more comfortable talking to a therapist from home.
It takes away some of those hurdles that prevent people from seeking help.
Absolutely.
Okay, so let's say you've got access to therapy. You're taking care of your physical health.
Okay.
What else can you do to proactively manage your mental well-being?
That's where those stress reduction techniques come in.
Like?
Things like mindfulness meditation,
Okay.
journaling, even spending time in nature.
Those are all supposed to help with stress.
They help build resilience.
I've always been skeptical about meditation, to be honest.
Really? Why is that?
I picture myself sitting cross-legged chanting, ooh, feeling totally ridiculous.
I get it, but there are more approachable ways to meditate.
Oh, like what?
Those apps like Calm and Headspace,
I've heard of those.
they make it a lot easier to get started.
So it doesn't have to be that traditional image of meditation.
Not at all. The key is finding what works for you.
Right.
Some people find it in gardening or listening to music.
Even doing a crossword puzzle.
Sure. It's about taking time for yourself, doing something that helps you de-stress.
It's like hitting the pause button on life for a bit.
Exactly.
Speaking of pausing, one of the articles talked about setting realistic goals.
Oh, yeah. And celebrating small wins.
It sounds a bit cheesy, I know.
It can be helpful, though.
How so?
Well, when you're feeling overwhelmed, it's easy to focus on what you haven't accomplished.
Right.
But celebrating those small victories can give you a sense of momentum.
Like you're actually making progress.
Exactly. It's a way to build confidence and motivation.
It's like giving yourself permission to acknowledge those little achievements.
It's about shifting your perspective.
I like that.
And it can be really empowering.
So we've been talking a lot about strategies and techniques.
Yeah.
But I'm curious, what does the research actually say about these things?
What do you mean?
Well, it's one thing to offer advice.
Right.
But is there any scientific evidence to support these claims?
You don't want to be giving people false hope.
Exactly. So what does the science say?
Well, for example, studies have shown that regular exercise can be just as effective as medication for mild to moderate depression.
Wow, really?
Yeah, it releases endorphins, which have mood-boosting effects.
Makes sense.
And we know that sleep deprivation is linked to a whole range of mental health issues.
Like what?
Anxiety, irritability, impaired cognitive function.
So the exercise and sleep thing, that's legit.
It is.
What about those more alternative practices?
Like meditation and journaling.
Yeah.
There's actually a growing body of research on those as well.
Oh, interesting.
Mindfulness-based interventions have been shown to reduce stress, improve focus, and even increase gray matter in certain areas of the brain.
Wow, that's amazing. So it's not just some new age trend.
Nope. There's real science behind it.
What about journaling? I've always thought of it as a way to just vent frustrations.
It can be more than that.
How so?
Journaling can be a powerful tool for self-reflection and processing emotions.
I hadn't thought of it that way.
It allows you to explore your thoughts and feelings in a safe space.
Without judgment.
Exactly. And studies have shown that it can actually reduce symptoms of anxiety and depression.
That's incredible.
And even improve immune function.
So it's like having a therapy session with yourself.
You could say that.
But as we're talking about these individual strategies, it makes me think about the bigger picture.
What do you mean?
All those systemic issues we talked about.
The inequities, the lack of access to care.
Yeah, it feels almost unfair to put so much emphasis on personal responsibility.
When so many people face barriers that are out of their control.
It's like telling someone to pull themselves up by their bootstraps when they don't even have boots.
You're absolutely right.
We need to advocate for policies that address those root causes.
Poverty, discrimination, lack of access to quality care.
It's not just about individual effort.
It's about creating a society that supports mental health at every level.
It's a two-pronged approach.
Exactly. We need both.
Okay, but even with all these strategies and interventions, there's still this fundamental question.
What's that?
What exactly is mental health?
The million-dollar question.
One of the sources defined it as emotional, psychological, and social well-being.
Right, a very broad definition.
But what does that actually mean in practice?
How do we know if we're mentally healthy? I think it's less about achieving some perfect state of well-being
And more
but
about
having the tools to cope with life's challenges.
So being able to handle stress, build healthy relationships.
Exactly, and make meaningful contributions to your community.
It's not about being happy all the time then.
Not at all. It's about resilience.
Bouncing back from setbacks.
Finding joy even amidst difficulties.
And remember, everyone's different.
Of course. Mental health exists on a spectrum.
We all have ups and downs.
Exactly.
Right.
Having a bad day doesn't mean you have a mental health disorder.
It's like the difference between a cold and pneumonia.
Good analogy.
Both are respiratory illnesses, but one is way more serious.
And just like with physical health, early intervention is key.
We wouldn't hesitate to see a doctor if we had a persistent cough.
But for some reason, we often wait until our mental health is in crisis before seeking help.
Which brings us back to that stigma.
It's a vicious cycle.
But knowing when to seek help can be tricky.
It can.
What are some red flags that might indicate it's time to reach out?
It really depends on the person. But some common signs might be persistent changes in mood, like if you're feeling down or irritable for an extended period.
Oh.
Changes in sleep patterns or appetite trouble, concentrating, increased anxiety withdrawal from social activities, or even thoughts of self-harm.
Those are serious signs.
It's important to pay attention to those patterns and trust your instincts.
If something feels off for a while, it's worth checking in with a professional.
Exactly.
It's like we were talking about earlier, listening to your body, but this time it's your mental and emotional state.
Right.
We keep talking about stigma,
Yeah.
and I'm wondering, how does that actually play out in real life?
Well, it can show up in different ways, from subtle discrimination to being denied opportunities.
Oh, wow.
People with mental health conditions often face prejudice in the workplace or social settings.
It can even happen within families.
Unfortunately, yes.
You know, that reminds me of the podcast intro we talked about.
The one about American workers?
Yeah, the host talked about their own experience with anxiety and how it affected their work.
It's powerful to hear those personal stories.
It was eye-opening to hear about the challenges they faced, even in a workplace that was supposed to be progressive.
It shows that stigma can exist anywhere.
Even in places you wouldn't expect.
And it prevents people from seeking help or talking openly about their experiences.
It perpetuates that cycle of silence and shame.
Exactly.
But the fact that we are talking about it more now, that's got to be a good sign, right?
It is. The more we talk about mental health, the less power stigma has.
And there's research to back that up?
There is studies show that contact with people who have mental health conditions can actually reduce prejudice.
Interesting. So the more exposure we have, the less threatening it becomes.
That's the idea.
So personal stories, open conversations, media representation, those are all important.
They're all pieces of the puzzle.
It's about normalizing mental health, creating a more inclusive and supportive society.
Exactly.
But it's not just about changing attitudes.
Right. We also need to address those systemic barriers.
Access to affordable care, that's still a major issue.
It is, and the WHO report highlighted how much worse it is in developing countries.
Where resources are limited and stigma is often much stronger.
It's a complex problem.
It is, but there are organizations working to address these issues.
Like the Mental Health Gap Action Program.
MHGAP.
Yeah, it's a WHO program that aims to increase mental health services in low-income countries.
How do they do that?
By training non-specialist healthcare workers to identify and manage common mental disorders.
So it's about bringing mental health care to the front lines.
Exactly. Especially in places where there aren't enough specialists.
And it's not just about treatment, right?
No, MHGAP also focuses on educating communities, reducing stigma, promoting mental well-being.
It's a much broader approach.
It is. It recognizes that mental health is influenced by so many factors.
Individual, social, cultural.
So it all plays a role.
And it highlights the need for diverse solutions.
There's no one-size-fits-all approach.
So as we wrap up this deep dive, I'm feeling a mix of hope and urgency.
I understand that.
Hope, because we are seeing progress. Awareness is growing, research is advancing.
And there are new interventions being developed.
But urgency because there's still so much work to be done.
Especially when it comes to equity and stigma.
It's a long road ahead.
It is, but we're moving in the right direction.
What's one thing you hope our listeners take away from this conversation?
I hope they gain a better understanding of mental health as part of overall well-being, that they feel empowered to prioritize their own mental health and support others.
That's a great takeaway. And remember, everyone, you're not alone in this.
There are resources available, people who care, and always hope.
It's been a fascinating deep dive exploring all these different aspects of mental health.
Thank you for joining us.
And we encourage you to keep learning, keep talking, keep advocating for better mental health for everyone.
Until next time, take care of yourselves and each other.